You are watching COVID updates on Voice of Canada, and this is Sana Haroon. Transport Minister Somaril Gabra said on Friday that beginning October 30, passengers aged 12 and older must be fully vaccinated against COVID-19 in order to board domestic, transborder or international flights departing from Canada, as well as via rail and Rocky Mountaineer trains.
The global pandemic has significantly changed our daily lives, including limiting our ability to travel for business and to visit our family and friends. And we know today that vaccination is one of the most effective ways to reduce the further spread of COVID-19. Vaccination is making it possible to keep us safe while we cautiously return to doing the things that we love. And I would like to acknowledge that most Canadians have been doing their part in helping combating COVID-19 by getting vaccinated. And we are today following up on our commitment prior to the election and a commitment that we've debated vigorously throughout the election campaign. With rigorous travel requirements that include mandatory vaccine measures, we are continuing to take action to help keep Canadians safe from COVID-19. In the transportation sector, this means rules are in place requiring travelers to be vaccinated in order to board planes, trains, or vessels as of October 30th. Starting tomorrow, passengers flying on domestic, transborder, or international flights departing from Canada and passengers on Via Rail and the Rocky Mountaineer trains must be fully vaccinated in order to board. À partir de demain, les voyageurs devront être vaccinés. These requirements apply to everyone 12 years of age. Travelers will need to show proof of vaccination, and airlines and railways will be responsible for confirming the vaccination status of travelers. In the aviation mode, the Canadian Air Transport Security Authority, also known as CATSA, will also support operators by confirming vaccination status. There will be few exceptions for emergencies and special accommodation for designated remote communities, so residents can continue to access essential services. In addition, there will be transitional measures for unvaccinated foreign nationals who normally reside outside of Canada and who entered Canada prior to October 30th. Until February 28th, they will be able to take a flight for the purpose of departing Canada if they show proof of valid COVID-19 test at the time of travel.
The National Advisory Committee on Immunization (NACI) has a new guideline on which Canadians should receive a third COVID-19 vaccine dose.
10 months after her second vaccine, emergency room nurse Nancy Halupa can now re-up on her COVID-19 immunity with a booster.
It would just be that added insurance that we have another layer of protection.
Frontline healthcare workers, seniors over 80, and adults in First Nations, Métis, and Inuit communities are strongly recommended by Canada's National Advisory Committee on Immunization, NACI, to get their third COVID shot at least 6 months after a second. Seniors 70 to 79 may also be offered boosters, as well as Canadians who have received 2 doses of AstraZeneca or 1 of the Johnson & Johnson vaccine.
These vaccine recipients may be susceptible to infection sooner.
Viral vector vaccines have been found to be less effective than mRNA shots, which Dr. Teresa Tam says are providing strong, sustained protection.
For the general population, there is agreement that they don't need the vaccine in any short, immediate future.
Still, provinces and territories seem to be making their own plans when it comes to boosters. Already BC, Yukon, and the Northwest Territories are offering third shots to certain populations, with Ontario to follow next week. Meantime, parents are left wondering when they can expect first doses for kids.
I'm excited for them because it'll protect them, especially that they're in daycare and school.
According to Canadian health officials, Pfizer's pediatric formula won't be approved until mid to late November.
I think it's important that we don't cut any corners and we continue to trust the process.
A process that requires patience, one in place to protect even the youngest of Canadians.
Two nurses in British Columbia who have not been vaccinated for COVID-19 are speaking out over concerns that the province's vaccine mandate for healthcare workers could have a huge impact on patient care.
I worked really hard to be a nurse, and I love my patients. I love my job.
Andrea Henders gets emotional talking about being forced off her nursing job at Kelowna General Hospital due to BC's vaccine mandate.
Sad, frustrated, disappointed.
She's among the roughly 1,300 healthcare staff in the Interior Health Region now on unpaid leave because she hasn't had a COVID-19 vaccine.
I'm currently still waiting for the science on this one. There isn't any long-term data on the vaccine yet.
Her colleague, Haley Hunter, echoes the sentiment about the vaccine and not being able to work.
It doesn't feel real at all. I'm still in shock that this has happened and that this has gone this far.
Both nurses say the loss of hundreds of healthcare workers across the province will take a huge toll.
I'm terrified for patient care.
Adding that an already existing staffing shortage will become even worse.
We never get our breaks. We work 12-hour shifts. We're running off of our feet. People are doing the bare minimum. So now that we are gone, our co-workers are left to pick up these pieces. I don't know how they're surviving.
While the Ministry of Health admits this will create challenges such as delayed surgeries and intermittent hospital bed closures, the minister stands firm the vaccine mandate is necessary.
This is a very strong action needed in a pandemic to protect healthcare workers, other healthcare professionals, patients, and the public.
But the nurses wonder why the government didn't consider options other than mandatory vaccinations.
A lot of us would have, been open to rapid testing, daily testing, temperature checks.
The nurses have until November 15th to get their first dose or face termination. These two feel so strongly they will choose to be terminated.
For those people that say that they would prefer no nurse at all to an unvaxxed nurse, clearly has not been in the hospital.
And while they don't know what their future holds, they're still hoping to be called back to work.
We're kind of sitting here on standby, let us work, let us care for our patients safely and effectively.
Using personal protective equipment and the other tools that have been in place since the start of the pandemic.
Over the past 20 months, many doctors across Canada have been seeing patients over video calls or by phone.
Yes, okay. And does your throat hurt as well?
Over the past 20 months, many doctors across Canada have been seeing patients over video calls or by phone.
The higher the cases, the less likely that patients actually wanted to come to be seen in the clinic. And because the risks were higher, we would try and triage them over the phone.
Family physician Jennifer Kwan says up to 70% of her appointments during the pandemic were virtual.
I think it's less about myself, but more for my staff and my patients. Sometimes we do have patients that are very high risk coming in, whether they are pregnant or seniors, immunocompromised, or even newborns. So my concern is that if I was to get sick, then that can potentially transmit to them.
Given the option between virtual and in-person care going forward,
I actually prefer in-person visits because it's so much easier to get the history, do the physical examination, and order the test. However, there are drawbacks. Virtual care would be appropriate for a quick follow-up of results. For patients who have trouble accessing the clinic or are unable to take time off work or cannot drive to the clinic or live quite far. Both options should be made available.
Catherine Smart, president of the Canadian Medical Association, agrees.
What I'd like to see is that we take the lessons we've learned about virtual care from the pandemic and integrate virtual care into our system. I think it would be a mistake to not continue with the option of virtual care.
Smart says virtual care can never fully replace in-person visits.
Physical exam, being able to see someone in front of you is very important, but there's many issues that can be addressed in a virtual format. I think a hybrid model is what we're going to see moving forward.
Adam Kasim, president of Ontario's Medical Association, says finding the right balance between the two will be key.
We got to find out what the best intensity is, so how much, the frequency, so how often, the duration, so for how long, and then ultimately the correct patient population to be selected.
Including insight from both doctors and patients.
Healthcare is a team sport, and it requires a relationship between a physician and a patient, and so that conversation has to happen in real time. It has to happen in the context of that individualized patient interaction.
Although COVID-19 cases are declining across the United States, tensions are still heating up over vaccinations.
And just relax your arm.
U.S. Vice President Kamala Harris received her COVID-19 booster shot while strongly urging all Americans to get vaccinated. About 30% of the U.S. adult population still has not gotten a single shot.
The vaccines are free, they are safe, and they will save your life.
We, the people, will not conform.
Across the country, vaccine mandates are leading to angry protests. All New York City public workers are required to be vaccinated by Monday. Garbage is piling up as sanitation workers call in sick. Hundreds of police officers and firefighters are still refusing to comply.
New York City is going to come to a crisis on Monday morning. Response times are going to go through the roof.
COVID-19 has been the leading cause of death for America's law enforcement officers since the pandemic began. Millions of federal workers are also facing a November 22nd vaccine deadline as the Biden administration fights to end this pandemic. Young children will be vaccinated next after Pfizer received emergency FDA approval to immunize kids ages 5 to 11. Shots could begin early this week.
We certainly hope that as people see children getting vaccinated and being protected and being able to participate in activities without concern, that more and more people will get their kids vaccinated.
Proof of vaccination will be required by most businesses in Los Angeles starting Thursday, leading to even more controversy.
I'm in the hospitality business. I want to make people feel good and not bad.
New COVID-19 infection rates and hospitalizations are finally trending down in the U.S., but health experts are concerned the virus could start spreading again after the holiday season.
We are now heading in the right direction, but with cases still high, we must remain vigilant heading into the colder, drier winter months.
That's why the push is on to get millions more vaccinated. But it's been a tough sell, even though the virus has killed almost 750,000 Americans.
Ontario Deputy Prime Minister and Health Minister Christine Elliott said on Wednesday that the decision not to implement a mandatory COVID-19 vaccine policy for hospital workers is the right decision for right now based on a risk assessment.
We decided that this is the right decision for right now here in Ontario. While individual hospitals can make their own determination, we had to really do a risk assessment, taking a look at the answers that we received from the many groups that the Premier sent the letter to, as well as what's going on the ground in other jurisdictions. And we know that in British Columbia, for example, they've had to cancel some of their scheduled surgeries because they've got about 3,300 workers that are out on leave now and are being requested to have vaccinations. And Quebec has just announced that they are taking another look at their original mandatory vaccination policy. So we took a look at that and the concern that we had that we would lose some of our precious health human resources compared to a relatively small number of outbreaks. And that's why the determination was made not to proceed with a mandatory policy at this time, although we're continuing to watch the numbers every day, and we'll see what happens as we go further into the winter. We heard from different groups, depending on where they are in the province of Ontario. Some places are really struggling more with health human resources than other areas. But that's one of the primary concerns that we needed to take into consideration, because we don't want to have to cancel surgeries. In Ontario, we've been very fortunate that we've been able to keep those surgeries going, even though we still have thousands of people that are waiting for those surgeries for hip and knee replacements, which are painful for people, prevent some people from being able to work, cataract surgeries and so on. People have been waiting long enough, and so as government, we have a responsibility to protect the health and well-being of all Ontarians. And so that's why this decision is the right decision for Ontario right now. Significant And that is why we want to be able to maintain our health human resources so that we can care for the people with COVID, of course, but also care for all of the other people who've been waiting for surgeries. And we've got thousands of surgeries that are waiting, not to mention diagnostic procedures. And we know that what we're seeing in our hospitals right now are patients that are more acutely ill, because to some extent we've had to postpone some of those diagnostic procedures. We want to be able to keep those going so that we'll be able to treat people in an earlier stage of an illness so that they can become well. We're certainly not saying that. We have been urging everyone in Ontario, particularly frontline healthcare workers, to please go and get vaccinated. We've said that from the beginning. We will continue to say that. That's the best way to protect individuals, families, and communities. But in that situation where there are some who are not being vaccinated, we still have very rigorous testing procedures there for the protection of their patients and the families that come in, that they will need to undergo a rigorous PCR testing to make sure that they are healthy and won't transmit COVID to any other patients. We're dealing with healthcare in Ontario. As I said before, this is the right decision for right now, but we're going to continue to monitor it, and especially as we go into colder weather with more and more people being indoors, we'll continue to review it to see if it remains the right decision for Ontario. If we're seeing an increased uptake, then, and especially in workplaces, in hospitals, then we will need to revisit it. But right now, this is the right decision because it allows us to continue with our responsibility to protect the health and well-being of everyone in the province.
Thanks, everyone.
Thank you.
Keep watching COVID updates on Voice of Canada. For further updates, visit our website voiceofcanada.tv.